Hello everyone, my name is Will Knights and my group is Health and Wellness. The United States faces a hidden crisis. The health, economic, and social pressures created by the COVID-19 pandemic are building toward an explosive mental health crisis that risks severe and lasting damage to lower-income U.S. individuals and families. According to a 2020 study in the JAMA Network Medical Journal by Catherine Ettman and Associates, mental health cases in America are rising at an alarming rate, roughly tripling due to the pandemic. Low-income people already lack the resources to cope with constant stressors, such as the lack of job security and access to quality health care. COVID-19 and its related complications have only multiplied the gravity of these challenges, bringing to light a social inequality that has mostly gone unnoticed in the United States. With a simple donation to Mental Health America, you can help solve this problem. Mental health problems have always plagued lower-income people. This statement has become even more relevant as COVID-19 ravages low-income individuals across the nation. A key reason why low-income people are at such a high risk is because they face constant stress from the lack of resources and social opportunities, such as their inability to work remotely, who, if anyone, is going to watch their children, or how they will support themselves or their families if they get sick. In Psychiatric Times, an article by Dr. Mark Mansue and colleagues in 2018 wrote that low-income individuals who develop a mental health illness are highly likely to redevelop problems for their entire lives and even transfer them into children. At the onset of COVID-19, mental health experts knew that mental health cases would rise, but their predictions of how much fell short. As reported by Ettman and Associates in the aforementioned journal, mental health problems have skyrocketed as COVID-19 has spread, with low-income persons being 50% more likely to develop a mental health issue. Eric Morath reports in the Wall Street Journal that the Labor Department predicts as of 2020 an estimated 20 to 40 million people could lose their jobs or be laid off, adding to potential cases. Lackluster support for mental health cases among low-income persons will grow even worse as thousands to potentially millions flood the system. According to the World Health Organization, as of September of 2020, COVID-19 is not going away anytime soon, as the nearest vaccine is roughly a year to a year and a half away. Many of these most vulnerable are essential workers who are making sure that grocery stores are stocked, hospitals have the needed supplies, and neighborhoods are safe. These citizens are the backbone of our economy and help support daily life. In a Pew Research study, demographic expert Rakesh Kochar reported that in 2016, low-income people made up almost a third of the entire population of America. The longer these mentally ill individuals go untreated, the harder it will be for the U.S. healthcare system to respond. Donating online to the nonprofit organization Mental Health America through their website mhanational.org is an effective way to help lower-income people who are most at risk of mental health problems. Mental Health America is a highly accredited nonprofit that specializes in helping mentally ill individuals, organizing community events and educational activities, in addition to influencing public policy in favor of solutions to mental health issues. Their outreach style directly follows Dr. Mansue and Associates' suggested solution. By focusing on 3 levels instead of 1 or 2, mental health cases can be more effectively identified, controlled, and prevented. As reported by Qingsong Chang et al. In the National Library of Medicine, surveys of low-income people showed that policies that increase awareness, education, community, and individual support of mental health issues would be beneficial. Perhaps the greatest barrier is the perception held by many college students that we do not have enough money to make a worthwhile donation. Most students, like ourselves, have the resources to donate a small amount on a regular basis that could add up over time. According to charity rating websites Charity Navigator and Charity Watch, Mental Health America has a very high financial accountability rating, so donors can have peace of mind that any contribution will be put to good use. Certainly, volunteering is a noble activity, but it becomes tricky for several reasons. First, COVID-19 makes it hard for social interaction and community support. Second, as college students, we typically have very little time and very busy schedules, not to mention a lack of transportation. Thus, the most effective method is to donate. The United States faces the threat of two crises, COVID-19 and the surge in mental health cases. Americans living in poverty or low socioeconomic status are most at risk to these threats. The mental health epidemic will only become more severe as the COVID-19 pandemic continues and might reverberate for generations. Despite perceived barriers, supporting Mental Health America through online donation is an easy and extremely effective solution. Donating is a way we college students can make a difference today. The rest of society depends on this group to support the economy and provide essential services. America must act to defeat the hidden mental health crisis alongside the COVID-19 pandemic. Thank you.